Drugs are among the most life-altering compounds which could either improve your health when used legally and appropriately or lead to serious damage or death when persons abuse their use. The harm could be immediate or manifest over a long period, and by then it's too late. So for the sake of our good health, avoid the risk and stay drug-free. Hello, it's Drug Awareness Month and this is Jamaica Magazine. I'm your host, Adrian Atkinson. Welcome. On the pages today, a look at the work of the Jamaica Anti-Doping Commission, plus mitigating the effects of climate change on farming, and then the shift towards excellence in healthcare. Stay with us for all that and so much more.
Yes, indeed. It's Parents Month. So come out this Saturday, November 9th to the Grandparenting Village at the Ronnie Williams Entertainment Center. There will be roundtable discussions, tips on good parenting, displays, a children's village, and so much more. That's the Parenting Village this Saturday, November 9th at the Ronnie Williams Entertainment Center. Brought to you by the National Parenting Support Commission. Supported by NCB, Events to Events, and Royal Computers. And admission is free.
The work of the Jamaica Anti-Doping Commission, JADCO, is important for preserving integrity in sports. To ensure it can do that job, the government has increased the agency's budget and is providing other forms of support. The goal is to make JADCO the best in the world. Watch this.
It's an all too familiar occurrence. Something that can completely tarnish an athlete's reputation and career. And it's an issue that requires careful attention and analysis. Doping is, simply put, violating any of about 8 anti-doping rules.
If you refuse to take a test, for instance, it is an anti-doping rule violation. And once you refuse to be tested, it is taken for granted that you are positive. If you disrupt or do anything to disrupt a testing process, it is an anti-doping rule violation. If you are caught in possession, just in possession of a banned substance, it is also a violation.
Trafficking or attempting to traffic a banned substance, providing or administering a banned substance to another person, or having a prohibited substance in one's body are some other examples of an anti-doping rule violation. Understanding the doping process and what is expected of an athlete may seem difficult, but there is help. In steps the Jamaica Anti-Doping Commission, JADCO, the regulatory body for anti-doping matters here in Jamaica.
We test athletes, we educate athletes, and we do significant research in anti-doping.
JADCO subscribes to the World Anti-Doping Code, which was adopted by the World Anti-Doping Agency, WADA, the international body responsible for cleaning up sporting competitions. And a major part of that is making sure that athletes in all competitive sports abstain from using methods or substances which would give them an unfair advantage over others.
You must understand that what you need is to maximize your God-given talent naturally. Once you start getting into sport, you must understand that sport has changed. Anti-doping is here to stay. We will be testing you. So don't play around with your talent, don't play around with your future by taking it for granted.
To ensure athletes conform to specific guidelines, random doping tests are conducted at JADCO's convenience.
The testing process entails identifying first the athlete, then we decide if it is in competition or out of competition. Out of competition can be within a designated time to be decided by the athlete, or we can turn up anytime, anywhere, and ask the athletes to give us a sample of urine for testing.
We have a group of top athletes that we place in what we call a registered testing pool. And these athletes now, they give us what is called whereabouts information. That is information on where they're going to be at any given time. 3 to 6 months in advance. So now we can go wherever they are without their knowing and just test them.
After the urine sample is collected, it is tested. The results are published and sanctions of varying magnitudes will be issued to athletes depending on the severity of the violation.
I know about 3 or 4 groups. You have prohibited substances, you have substances that are not performance enhancing but come under the JADCO code, and that would be a lesser penalty as some of these over-the-counter prescriptions that you can get. You won't be banned, but you will be sanctioned. And there are different rules that apply to different substances.
But JADCO and by extension WADA would perhaps much prefer educating athletes so they know what is required.
We go into schools and talk to young students just like that. We visit clubs and sporting clubs across the island. We have workshops that we carry across the island. We have our music video, and we have public service announcements and these things. And of course we have props like these, caps, t-shirts and so on, that helps to reinforce the message.
Jamaica has a long and distinguished record in sports, especially in track and field. It's up to everyone, athletes, coaches, other members of the sporting fraternity, as well as the public, to ensure we keep it going.
We're trying to create an anti-doping culture, and by that we mean a space in which the athlete will thrive in order to produce his best. All right? And so everyone is part of that culture.
More Jamaicans are poised to become title holders. The Land Administration and Management Program, LAMP Phase 2, is heading into more parishes. From St. Elizabeth, Manchester and Clarendon, help with processing land titles is now being offered to residents of St. James, St. Anne, Westmoreland, Hanover and Trelawney. If you are in any of these areas, seize the opportunity to have your land surveyed and certain taxes and fees waived on your way to formal land ownership. Contact LAMP today to secure your asset, your piece of the rock. Call 927-1893 or 977-6089. Email info@lampja.com or log on to www.lampja.com. LAMP 2 one-stop shop for accessing land titles at a fraction of the cost.
The evidence is right before our eyes. The impact of climate change can be seen everywhere. Extreme weather, extended drought periods, more frequent floods and more intense hurricanes. They are all taking a devastating toll on farming and the livelihood of whole communities. But all is not lost. Government is working to ensure Jamaicans learn how to adapt to climate change and lessen the impact. How? Watch this.
The Rio Minnow watershed in Clarendon, Jamaica is home to Jamaica's longest river, the Rio Minnow, which is approximately 93 kilometers. In the upper section of the watershed lives farmer Blair, who along with many farmers make a living by growing a wide range of crops including cabbage, callaloo and peppers. However, farming in this area is not without its challenges. Farmers in the watershed have to confront the direct and indirect impacts of climate change.
Rainfall is the only source of water supply for the farmers in this area. But based on climate projections, these farmers might be in for a rude awakening due to changes in the rainfall pattern and the increased frequency of drought. Take, for example, this pond, which is normally 20 feet deep. It has now been reduced to a mere 5 feet because of drought.
Warning, warning, warning. Climate change is happening. We got to do something, no doubt. To the world, we're calling out.
It's like a gambling when we farm, when the rain is, because we have excess rain, long rain, Whenever it's dry, we have long drought.
So right now you don't even know when to put in whatever to put in the soil, in the crop, the crops. It's hard to predict.
The experiences of farmers in the Rio Mino watershed are common to that of most farmers in Jamaica. This is because, like many other small islands in the Caribbean, Jamaica is highly vulnerable to climate risks.
It touches and concerns every ministry. And in fact, one of the things we are going to do is to advocate that there is a line, a budget line in each ministry that is making provisions for climate change.
Over the last 12 years, the country has been impacted by 11 storm-related systems, which have caused severe damage and losses to the economy.
The effects of climate change on communities like these in the Rio Mino watershed have to be understood and addressed in order to build the resilience of Jamaica. This is exactly what the pilot program for climate resilience seeks to do.
Jamaica is one of 6 pilot countries in the Caribbean benefiting from the pilot program for climate resilience. The others are St. Lucia, Dominica, Haiti, Grenada, and St. Vincent and the Grenadines.
There are 3 objectives to the pilot program for climate resilience. There are 1, improving the quality of climate information for decision making at the national and local levels. 2, mainstreaming climate change adaptation in development planning. And 3, improving access to climate financing for micro, small and medium enterprises and for non-governmental organizations at the community level.
This type of programmatic approach or integrated approach presents an avenue for financial institutions like the Inter-American Development Bank in collaboration with other partners to help countries address the impacts of climate change.
We're really excited about what the pilot program for climate resilience has done for Jamaica's climate change adaptation program. One of the things that we really want to highlight is the fact that the network for meteorological services has been greatly enhanced. We have been able to install 20 automatic weather stations to improve the collection and management of climate data, to downscale regional climate models for Jamaica, and we can tell you what Jamaica's climate is likely to be up to 2080.
It's a critical element of our work on climate change within the region, and we want to be able to replicate, to scale up across the country, even across sectors.
Bless up, bless up, bless up. Farmers in the Rio Mino watershed and the other areas of Jamaica can now breathe a sigh of relief because they will not be left on their own to deal with the impacts of climate change. Now they can collaborate with the IDB and the government of Jamaica. Through programs like the Pilot Program for Climate Resilience, Jamaica is fast becoming the place of choice to live, work, raise families, and do business.
Government, through the Ministry of Health, is moving earnestly to secure the good health of every Jamaican as an important part of the development plan to make Jamaica the place of choice to live, work, raise families, and do business. More on that next.
Securing access to affordable and quality health care for all. That's the key objective that has been driving the work of the Ministry of Health this fiscal year.
The ministry will spearhead the protection of individual and population health through the promotion of healthy families.
Operating a high-quality healthcare system in a tight economic atmosphere is costly and requires a sustained means of financing.
The ideal is for about 10% of GDP to be committed to healthcare.
In early 2013, the Health Ministry initiated a national dialogue, inviting Jamaicans to submit proposals for health financing in a series of public consultations.
We will be strengthening mechanism for the collection of co-payment from insurance companies. We will be putting in place specialist services that will not be covered under the policy, as well as private medical wards in some public hospitals through public-private partnership.
Another aspect of health financing getting the ministry's attention is individual payment options. For the first time in the country's history, a Government of Jamaica GOJ health card will be introduced.
The card will facilitate better monitoring and identification. It will also take into account private health insurance so that instances where charges arise, we can better, adequately and quickly deal with it.
The GOJ health card should also optimize the delivery channels for pharmaceuticals. At the same time, new equipment is being purchased where necessary. And as the ministry advances the modernization of the health sector, the National Health Information System goes digital this year.
We are moving from a strictly paper-based system of storing health records to electronic storage and retrieval of patient data.
Even as it ensures health facilities are well equipped, the ministry is also making sure they are well staffed. Efforts to do that include an agreement with the Cuban government for 29 nurses, 8 medical doctors, 6 dentists, and a cytology technician to work in the public health sector. A strategic plan has been formulated to address the 4 major conditions causing deaths, namely cancer, diabetes, cardiovascular diseases, and respiratory illnesses. The 4 major risk factors, physical inactivity, unhealthy eating, harmful use of alcohol and tobacco, are targeted.
It will also address violence and injury prevention, mental health, oral health, kidney and sickle cell diseases. The government is committed to the World Health Assembly resolution of 2012, for which Jamaica was very strident in getting that resolution, to reduce premature deaths from non-communicable diseases by 25% by 2025.
A cancer control plan for Jamaica is being advanced this year to include the reintroduction of nuclear medicine technology for improved diagnosis and treatment, while 2 linear accelerator machines are being procured for radiation treatment. As for tobacco control, cigarette smoking has been banned in specified public places. Innovative approaches are also being initiated in the fight to cut Jamaica's HIV infection rate. The strategy provides for a clearly identifiable AIDS authority and will expand and improve the integration of family planning, maternal and child health, sexual and reproductive health, and HIV/AIDS in primary health care. The modernization of dentistry in Jamaica is another priority for the Health Ministry this year. Amendment is being made to the Dental Act and regulations to ensure reliable and consistent standards. And in partnership with the non-profit group Great Shape Incorporated, the ministry is introducing a national sealant program to reduce the number of extractions, especially in children. The Ministry of Health, employing innovative, cutting-edge approaches to the management of healthcare, creating systems of excellence to advance the health agenda for all.
This week on the Community Notice Board, the Jamaica Urban Transit Company is advising the public that the planned discontinuation of the bus transfer system will be delayed by 1 week. The original proposed date of Sunday, November 10 has been changed to Sunday, November 17. This is to allow the company to engage citizens in a public education discussion on the matter over the coming week. It's also to allow the commuting public to familiarize themselves with the alternatives that are available. Club Beauty International Ministry CBIM will have its grand launch on Sunday, November 10. Be at the Glad Tidings Open Bible Church, 1 Ebanks Avenue in Spanish Town, St. Catherine. Come share in the fun, share in the ministry, and learn how you can help women who are in need of help. For more information, call 597-1908 or 464-4958. The Chapelton community is invited to come out and celebrate with the Salem United Church family as it marks 175 years of ministry. The celebration is being held under the theme Renewal and Transformation for Life on Sunday, November 17 at the church, Salem Avenue in Chapelton. Starting time 10 a.m. Send us your events for broadcast on the JIS Community Notice Board. Call 922-868-022 or send an email to cbishop@jis.gov.jm.
Leadership, building leadership skills and applying it to those around in your little peer groups. It can help to make a better tomorrow for everyone involved, those to come, those who are here.
The majority of them have to go back to school, though. Implement back to school, try to get a better education and start out from there.
Young people can, do charity projects to develop the country much better.
I think young people can use their skill and to work on it and use it and make money, because some of them can bake, they're good in food and so forth, so they can bake things and go out and sell.
Join the fight. Quit smoking for life.
Prime Minister Portia Simpson Miller shared investment opportunities with the Japanese business interests and signed a technical cooperation agreement with the country's leader. And OPM launches multi-million-dollar project to upgrade high school sport infrastructure. Here's a recap of those and other important news stories from this week.
Hi there, I'm Simone Wolf with your JIS News of the Week. Prime Minister Portia Simpson Miller wrapped up a successful working visit to Japan on Friday. The trip was planned to strengthen friendship and cooperation between the two countries and shore up international support for Jamaica's economic program. Progress was made when the Prime Minister signed a joint declaration for the strengthening of bilateral relations with her Japanese counterpart. A technical cooperation agreement was also signed.
Jamaica welcomes increased activity by Japanese firms and investor interest in our country. We also discussed innovative ways of promoting greater dialogue and expanding investment opportunities aimed at facilitating increased trade flows in both directions.
Mrs. Simpson Miller also met with a number of Japanese investors, including the Yoshima Coffee Company and the Japan Association of Travel Agents. The visit culminated with the Prime Minister making a presentation at a Latin American and Caribbean Business Forum put on by the Japanese government and the Inter-American Development Bank. Back at home, the IDB announced its approval for Jamaica to use the public procurement subsystems for projects financed by the bank. The approval was granted to Jamaica and several other regional countries. A release from the IDB said the approval reflected the bank's confidence in the country's efforts at improving their public procurement systems, which represented an $800 billion market in the region. The decision establishes a basis to expedite contracting processes by avoiding duplication and reducing transaction costs. Meanwhile, persons wishing to become entrepreneurs will be able to benefit from an island-wide entrepreneurship program. The Ministry of Industry, Investment and Commerce, through the Jamaica Business Development Corporation, will be taking its entrepreneurship workshop into communities to spur business development.
We plan to go through the island of Jamaica starting next year, and we're going to train entrepreneurs throughout Jamaica. And JBDC has worked with me in my constituency to do that, and we trained 80 new entrepreneurs.
Minister with responsibility for sport Natalie Nita Headley led a school tour this week to launch a $250 million project to upgrade sporting infrastructure at 23 high schools. The Sports Infrastructure Improvement Project is an initiative of the Office of the Prime Minister's Sports Division with support from the Ministries of Education, Agriculture and Local Government, along with other stakeholders.
Under this project, 10 schools will be targeted by the Sports Development Foundation in Phase 1 to the tune of $100 million.
A new and improved X-ray department is now in place at the Princess Margaret Hospital to provide better diagnostic services to patients. The department, refurbished at a cost of $8.3 million, was fitted with a new digital X-ray unit purchased for $12.6 million.
It will really bring to the fore the opportunity for faster throughput, more patients coming through, timely response, which means better and shorter time for diagnosis, definitive diagnosis. It also allows physicians to access the images remotely.
Work is to be carried out to further upgrade the accident and emergency ward at a cost of $40 million, while funding has been sourced to purchase a new infant warmer and incubator, both totaling $3 million. And finally, the House of Representatives has passed the Defamation Act 2013, replacing the decades-old slander and libel laws. The act abolishes the distinction between libel and slander and instead establishes a single cause of action known as defamation. Among its objectives is the creation of a more equitable balance in the resolution of cases.
These are to provide fair and effective remedies for persons whose reputations have been harmed by the publication of defamatory matter. It also provides for speedy, non-litigious methods of resolving disputes concerning the publication of defamatory matter, and it ensures that the law of defamation does not place unreasonable limits on the freedom of expression.
And those were some of the stories making news this week. I'm Simone Wolf.
That brings us to the close of today's edition of Jamaica Magazine. It was good sharing this half hour with you. Don't forget, we value your feedback, so drop us a line. Send an email to jamaicamagazine@jis.gov.jm. You may also follow us on Twitter at JIS News. On behalf of the entire team here at the JIS, I'm Adrian Atkinson, inviting you to join us again tomorrow. Until then, do take care.
This has been a production of the Jamaica Information Service, the voice of Jamaica.